Okay, my name is Kayla Evans. I am doing a presentation on the ethical analysis of abortion. I uploaded a separate link of the presentation, and then I'll just be presenting that here. So, I'm going to start with what abortion is. Abortion is the termination of a pregnancy. So it's a planned medical procedure, which brings about a lot of tough questions about like what's right, what's legal, and what feels right personally. The ACA Code of Ethics doesn't explicitly mention the word abortion, but they do give guidelines to help counselors deal with tough situations. The ethical problems that are with abortion are the moral beliefs and the values regarding life, autonomy, and rights. So those can be with the counselor and the counselee. And then between those two, the counselor should already have identified their specific points of ethical conflict of where their limits are. And then they have to talk with that through the counselee, see where their limits are. The legal issues, it varies where you live. Some places have legal restrictions or allowances on abortion, and so those have to be researched. Professionally, for counselors, it depends, or it relates to their respecting the client autonomy and their own personal values. So they kind of have to choose which one they want to lead with, whether or not they're going to keep with their values or stick with that client autonomy, which means not transferring their client if they agree with what they're going through or however that works out for them. Clinically, this can cause psychological distress, emotional trauma, mental health considerations for the client. So it's important for the counselor to acknowledge these psychological and emotional impacts and then develop a plan to address potential client distress. So on the issue scope of things, you have to consider your own personal beliefs as a counselor and values on abortion, and identify the potential biases or conflicts that may impact your professional judgment. When then dealing with a counselee, you have to, based on your personal values and beliefs, then decide, is this going to be helpful for them if our beliefs differ, or if they're the same, should I just go ahead and refer them out? Because the client's decision or the counselee's decision impacts the relationship that you're going to be able to have or the words that you're going to be able to say. So you have to consider the client or the counselee's perspective and maintain their confidentiality and respect their autonomy. Doesn't really relate to technology. And then the relationship to institution and agency. If there were policies on abortion within counseling, then yes, it would relate. However, because the ACA Code of Ethics doesn't really give anything specific, we just continue on. So from there, we would also think about reaching out to other people, other counselors, seeing how they would handle this within a biblical context, and then not within a biblical context, depending on how the counselee is wanting to proceed. Of course, look at the ethical codes. They don't really say much, so that's where we're at. Think about the impact of decisions, not only on the counselee, but also on you yourself. You don't want to go against your own values and beliefs, so you have to keep that kind of forefront when talking about these difficult things. Be prepared to refer them. That's an option and needs to be considered. And then legal and ethical consultations for complex situations when you're not sure how to proceed. So when we're talking about abortion, I said the word autonomy a lot of times. This is the freedom of choice and action. So the counselors help the clients understand the weight of their decisions. And when we're talking about abortion and autonomy, this is respecting the client's right to make their own decision about abortion, even if it differs from your belief. You have to make sure that the counselee is fully informed about all options and consequences. Justice, this is treating each person with fairness and having a rationale for different treatment. When relating this to abortion, this is ensuring that access to information and resources regarding abortion is able to be accessed for all counselees, regardless of their backgrounds or circumstances. The beneficence is the counselor's responsibility to do good, be proactive, and prevent harm. When relating this to abortion, we're providing support and resources that promotes the client's well-being regardless of their decision. This may involve helping clients explore their options and potential emotional impact, where you also might have to, like I said before, refer out based on your own beliefs or values. And then non-malfeasance is not inflicting intentional harm and not engaging in actions that risks harming others. Because of the emotional impact that may happen with abortion, this one is a little bit difficult. The application to abortion is avoiding imposing personal beliefs on the client and ensuring that counseling does not contribute to psychological harm. The counselor would also refer the counselee if they can't remain objective. And finally, fidelity. The counselors must be loyal, faithful, and honor all commitments made. Like I said before, this would be referring out for me personally. The application to abortion is maintaining confidentiality and trustworthiness with the client and ensuring they feel safe to explore their options without judgment. And from a biblical standpoint, this doesn't really fit. However, we're going to support and refer and get other people's opinions.